Good morning, everyone. Thanks very much for joining us today. I'm Joanne Nowlin. I am the CEO for the LA region of the American Red Cross. And today is such an important conversation for us. I appreciate everyone finding the time to meet with us as we discuss our important next steps. What we're talking about is really the first step, part of our reentry. Based on information that we have, we don't have all the information, so we don't have all the answers, but our goal is to provide as much clarity as possible so we can safely return to our offices as needed. We've also been safely returning to in-person mission delivery. My biggest request is to give us patience. And I promise we are constantly looking at this information, looking at data. My number one goal is your well-being. So our workforce is so critical, so we want to make sure we're protecting you. I want to thank David Englund. He is our COO, and he has done a tremendous job, along with volunteers and staff and board members who've joined him as we've developed these plans and policies going forward. I think it's thoughtful, I think it's inclusive, and your feedback's very valuable. So please, let's work together on this because this is really good news. And as quickly as we closed our offices last March, it's going to take a little bit longer for us to reopen them so we can make sure we're doing it safely. So I want to introduce David, and thank you again, David. I appreciate your leadership.
Thank you, Joanne. And before we begin, just a couple of program notes. So I am going to ask if everybody, we have a lot of participants on this call, so if everybody could please make sure you're on mute and stay on mute until the question and answer session. And also turn off your cameras. With so many people, when people have their cameras on unnecessarily, it creates some bandwidth issues and connectivity issues and can slow things down. So with that, I'm going to dive in. So here's today's agenda. So in just a couple of minutes, we're going to start the briefing on the policy. That's going to take about 20 minutes. And then really the bulk of our time today is going to be a question and answer session. And then we'll wrap up right at 1 o'clock. So please hold your questions until the Q&A session. And in order to ask a question when the time comes, please raise your hand in the Teams function and we'll call on you, or type your question in chat. If you have dialed in by phone, I see when I look at the participant list, I see a number of people who've used their phones to call in. I will, there'll be a period during the Q&A where I ask any of the people calling in by phone who want to ask a question just to unmute themselves and ask a question. We'll do our best to sort of manage it that way. So with that, let's begin. First, I want to say a word or two about the policy development process. This has been a real collaborative effort among a terrific group of people. The policies that you're about to review have been developed by the LA Region Post-Pandemic Transition Work Group. It's a bit of a mouthful. And this is a pretty diverse and inclusive group. We intentionally composed this group of employees, volunteers, and board members representing all of our departments, chapters, and lines of service so that we would get the best input and perspective that we could. And once the once the policy was, a draft version of the policy was developed, we also heavily circulated and reviewed the policy, made further edits and adjustments based on feedback. And so the review happened primarily the LA Regional Leadership Team. And then our regional executive, Joanne Nowlin, has a LA Region Change Advisors group that also reviewed and provided some feedback to really get us to a policy that we think strikes the right balance. And the policy accounts for a variety of directives and guidance from Red Cross national leadership, as well as directives and guidance from the CDC, Cal OSHA, and our local public health departments. So some opening notes. These are the rules and policies and procedures that will be in effect starting tomorrow, June 15th, 2021, in alignment with the state of California taking important steps towards reopening the economy. But this is merely a first step, and we're going to continue to assess, refine, and revise these policies on an ongoing basis as directives from national change, as federal, state, and local guidelines change, and as the circumstances, the real world circumstances on the ground here in Los Angeles change. But we want to be really clear there that, as Joanne mentioned, this is a baby step. This is sort of dipping our toe in the water of reopening, not diving into reopening. First and foremost, our goal is to protect the health and safety of our fellow Red Crossers. And so you may not get everything in this policy that you are anxious to have, but those things will come eventually. This presentation, along with a recording of this town hall, is going to be distributed this afternoon to all LA Region Red Crossers. We recognize that not everyone is able to participate in a lunchtime town hall meeting, and so we wanted to make sure that not only the information about the policy, but also the questions and answers to those questions in the Q&A session are distributed, and that's again happening via sending out the recording. And we'll reference a couple of links to outside sources and other resources in this briefing. Those links will also be distributed to all LA Region Red Crossers, so that everybody, even people who aren't able to participate at this moment, have the information they need. Let's start with talking about some definitions, because these key definitions are going to be important as we articulate the policy, understand the policy, and think through these various issues. The definition of somebody who is fully vaccinated is a person who has received the second dose of the 2-dose vaccine plus 2 weeks, or if it's the single-dose Johnson & Johnson vaccine, then 2 weeks after that, you're considered fully vaccinated. You're not considered fully vaccinated until that 2-week period has passed. A person who is considered non-vaccinated means either they've not been vaccinated at all for whatever reason, they're not yet fully vaccinated, see above. So if you have your 1-dose Johnson & Johnson shot and that happened a week ago, then you are considered by Red Cross policy to be non-vaccinated. And once you hit that 2-week mark, then you will go from being non-vaccinated to fully vaccinated. And any employee or volunteer who has not reported their vaccine status in either HR Now for employees or Volunteer Connection for volunteers is considered non-vaccinated. And as we go through the policies and procedures, if you do not report your vaccine status in either HR Now or Volunteer Connection, then as a matter of policy, organizationally, you will be treated as if you are non-vaccinated. So our hope is if you have been vaccinated, that's an incentive to report it in the system. The term staff in a Red Cross context includes both employees and volunteers. I really want to emphasize this point. As you hear us talking through the different policies and rules and everything else, you'll hear us use the word staff. And I just want to make sure everybody understands, our volunteers are vital and integral to our Red Cross workforce, and we consider you part of our staff. And so staff is interchangeable whether you're a paid employee or a volunteer. A couple of other definitions. Mask. Now, we've been wearing masks and living with a world of masks for well over a year now, almost a year and a half now. So you might think, well, I know what a mask is, but there's still some folks who are wearing bandanas and things like that don't really count as masks according to the CDC guidance. So we want to make sure it's important everyone understand that a mask is a face covering that complies with the CDC guidance. and you see in front of you, we provided the link to the CDC website where you can look up what counts as a mask. Just to be clear, it doesn't have to be a medical grade N95 mask to count as a mask. Probably most of what the majority of us wear day to day in the COVID environment qualify as a mask under the CDC guidelines. But if you have any questions at all, please click that link and look at the CDC website, and that'll answer those questions about what counts as a mask. And then socially distant, hopefully we all know after over a year that the term socially distant means keeping at least 6 feet apart between individuals. But again, we want to make sure that there are no questions there. Now let's talk about our vehicle policies. These are fairly straightforward. Staff may continue to utilize Red Cross vehicles in accordance with existing Red Cross vehicle use and authorized driver policies. If you have multiple people in a vehicle, regardless of any individual's vaccination status, any person driving or riding in a Red Cross vehicle with one or more other people is required to wear a mask at all times without exception. So if there are 2 people or 3 people or more in a vehicle, doesn't matter if you're all fully vaccinated, everybody has to wear a mask, period. Masks are not to be removed for the purpose of eating or drinking inside a Red Cross vehicle. Again, the point about eating and drinking, we did some analysis of this, and even in the worst case scenario in the LA region, if you have to drive 45 minutes to an hour, the work group determined that is a sufficient amount of time where it's not vital that you be able to eat or drink in the vehicle. So for the time being, the rule is if you can't remove a mask for the purpose of eating or drinking in a Red Cross vehicle. If you're in a situation where you have to have a mask on, then wait until you get to your destination if you need to eat or drink. If you are alone in a vehicle and fully vaccinated, this is the only scenario where you're not required to wear a mask in a Red Cross vehicle. A fully vaccinated individual driving alone in a Red Cross vehicle is not required to wear a mask. If you're alone in a vehicle and you're non-vaccinated, a non-vaccinated individual driving alone in a Red Cross vehicle is still required to wear a mask. So non-vaccinated equals mask. And just as a reminder, if you're wearing a mask in a Red Cross vehicle, you cannot remove that mask to eat or drink. Okay, so those are the vehicle policies. Hopefully that's pretty straightforward. Remote work. Staff will continue to work remotely from home. So in other words, remote work is still considered to be the sort of baseline normal expectation. However, if you are fully vaccinated, you have the personal option to work from a Red Cross office as long as you're complying with the policies that we're outlining today. So that's the key change. It's that loosened restriction to where if you're fully vaccinated, you have the personal option to work from one of our facilities. Regardless of your vaccination status, managers are prohibited from requiring any staff member to work from a Red Cross office or to work face-to-face in person with other staff or clients. And that is directive from our national leadership. So even if you're fully vaccinated, your manager cannot require you to attend an in-person meeting or to provide in-person service. Now, there are some exceptions to that. Disaster cycle services and SAFIS staff can be required to perform in-person, face-to-face service delivery functions in accordance with DCS and SAFIS operational policies and guidance. DCS and SAFIS a couple of weeks ago issued some national guidance around face-to-face in-person service delivery. So for those lines of service, those operational orders and policies and guidance take precedence. So if you're in one of those roles, your supervisor may require you to provide some in-person service, and those rules will apply. That's a separate set of rules from what we're talking about today. And additionally, operations staff, those are staff members who report to me as the chief operating officer, may be required to perform some essential in-person duties. An example of that is our facilities maintenance technicians, for example. If they need to repair an HVAC system in one of our buildings, that's not something you can do remotely, so they may be required to go into the building and provide that essential in-person service. All of our buildings for the time being, or until further notice, still remain closed to the public. And you will find if you go to one of our buildings tomorrow, there'll be signage to that effect, like there has been throughout the pandemic, directing potential clients to the phone numbers to call for service. But we want to make sure this is really clear, because as you as a Red Crosser are now, if you're fully vaccinated, authorized to go and work out of a building, that doesn't mean the building is fully open. It doesn't mean it's open to the public. It just means that you have the option as a Red Crosser to go and work from that building. Now, the exceptions to this, of course, are blood donors donating blood products during blood drives in our facilities. Of course, they need to be able to go in and out of those are members of the public that come in and out of our buildings to provide, to give blood. By our training courses run by training services, our training courses run by the nurse assistance program, etc. I just want to make sure you can all still hear me. I had look like a technical blip at my end. Can I get a thumbs up from someone just to confirm they can still hear?
We can still hear.
Okay, great. Thank you so much. The other exception to members of the public entering our buildings are, of course, authorized vendors providing services or across facilities. And there's a process that they go through with our facilities team. Mask policy. Regardless of an individual's vaccination status, masks will continue to be worn at all times while inside any Red Cross facility. There are a couple of exceptions. A fully vaccinated individual working alone in an enclosed workspace. So if you are fully vaccinated and you're just working by yourself in a focus room or a huddle room or a private office, you can temporarily remove your mask during that period while you're alone in that room. And fully vaccinated individuals may temporarily remove their masks while eating and drinking inside a Red Cross facility. We also do want to clarify that only fully vaccinated individuals can remove masks to consume food and beverage in the same room. So if you have a person who is in one of our buildings who is non-vaccinated because they received an exception to be in a building, if that person is in the room, other fully vaccinated people who may be in the room can't remove their masks for eating and drinking. So that's an important point. So just be sort of extra aware if you're in a context where you're going into, say, you're going into the break room in our headquarters building, for example, and you want to eat your lunch, just be aware of who's around you. Everyone in that room has to be fully vaccinated for you to be able to remove your mask. Social distance policy. Regardless of your vaccination status, you must remain socially distanced at all times while in any Red Cross facility. So even if you're in there fully vaccinated, fully masked, you still need to be socially distanced. Non-vaccinated staff. Non-vaccinated staff are prohibited from entering Red Cross facilities. There are some exceptions, but again, I want to drive this point home. This is the key distinction. If you're fully vaccinated, then you have the benefit of this new optional policy where you have the option to work from our buildings. If you are non-vaccinated, you do not have that option. You're prohibited from entering facilities. There are some limited exceptions. Myself, as the regional chief operating officer or my designee, can authorize individual non-vaccinated staff members to enter Red Cross facilities for the performance of essential in-person duties. So an example of this would be if I have a facilities maintenance technician who is not fully vaccinated, but who needs to go into a Red Cross facility to fix, say, an HVAC system, then I may authorize that person to do so. When they're in there, they have to operate under certain restrictions, which we'll talk about in a minute. But that's an example of where a non-vaccinated person may have the ability to enter a building. But those individuals, again, it's a case-by-case authorization basis. It's not people just sort of taking it upon themselves to say, well, I'm non-vaccinated, but I'm still going to go into a building. The other exception is the regional disaster officer or his designee may authorize individual non-vaccinated DCS staff to enter Red Cross facilities for the performance of their essential in-person disaster response duties. So similar scenario. All right, again, continuing on non-vaccinated staff. Any non-vaccinated individual who receives authorization from the COO or the RDO to enter a facility has to abide by certain requirements. First, they're required to wear a mask and remain socially distanced from others at all times. Now, this should be easy because whether you're vaccinated or non-vaccinated, you're required to wear a mask and remain socially distanced at all times. But the other point is a non-vaccinated person who is given special permission to be in a building is prohibited from removing their mask for the purpose of eating or drinking. So if you're non-vaccinated and you want to eat or drink, have lunch, or whatever, you need to go outside or go somewhere that's not inside a Red Cross building. Fully vaccinated staff, and our hope is this applies to the vast majority of folks, but fully vaccinated staff may exercise the personal option to work from Red Cross offices. You'll see some things in this presentation and then the policy that are a little repetitious, but that's because we really want to just make sure that the message gets across and drive points home. Now, I actually think, yeah, we'll do the contact tracing logs on the next page. Okay, so contact tracing logs, this is really important, and this applies to everybody. Each individual entering or leaving a Red Cross facility is required to sign in or out on a contact tracing log sheet that will be maintained at the front desk of that facility. When you go into our building starting tomorrow, at all of the front desks, there will be a clipboard with a sign-in sheet that says contact tracing log at the top. You're required to sign in. It includes the time you came in. And when you leave, you're required to sign out and sort of indicate the time that you left. This applies to every single facility. And this is really important because in the case where we do have any kind of COVID exposure, we then need to follow up with important contact tracing and make sure that we know exactly who was in that building at the same time as the person who might have tested positive or been exposed. Again, it requires, it applies to all facilities, including those without front desk staff. And what you'll see is, and we'll get to this in just a minute, we have a couple of facilities where we have front desk staff, security staff, and then we have a couple of facilities where we don't, and we can't require them because National has determined that we can't require people to work in person. So in those facilities, you'll go in, you'll find the clipboard on the desk, you'll sign in, you'll sign out, etc., and just leave it there for the next person. The other note on this is you need to sign in and out every time you go in and out. So if you're working from downtown, let's say you're working from downtown, you're fully vaccinated, you're exercising your personal individual option to work from downtown for 3 hours. And halfway through that 3 hours, you step outside to go get lunch. Well, then you have to sign out when you step outside to go get lunch, and then you have to sign back in when you come back in. If you are just popping into a building to pick up some supplies, even if you're going to be in there for just 5 minutes, you sign in, you get your supplies, take care of your business, and you sign out. Again, this is really important so that we can continue contact tracing if necessary. Indoor meetings. We do have the option under the new policies that go into effect tomorrow of indoor meetings. However, they continue to be discouraged. The regional chief operating officer can authorize the scheduling of indoor meetings in Red Cross facilities on a case-by-case basis. But these will be the considerations. Only fully vaccinated staff will be permitted to attend in person. Attendance must be completely optional and voluntary. Meeting participants will be identified in advance, and the meeting size and location will be limited based on room capacity, ventilation, and other safety considerations. An important note here, rather than publishing a COVID safe capacity for every building and every facility or every meeting room, et cetera, the control on whether or not the meeting space is big enough to allow for social distancing and have proper ventilation and all of that is this request process. So there's a link here to an indoor meeting request form, And again, this is one of the links that we'll push out to everyone. So if you want to have an indoor meeting where everyone is fully vaccinated and attendance is completely optional and voluntary, you can submit that request and we'll work with you to make sure that that's done in a safe way. Outdoor meetings are also permitted under the following circumstances. So the outdoor meeting must be approved in advance by the department head. Fully vaccinated and non-vaccinated staff are permitted to attend. Again, attendance must be optional and voluntary. Department heads are responsible for keeping a log of meeting participants in case contact tracing becomes necessary. Again, because it's outdoors, we don't have you passing through that entry point to the building, so you're not automatically completing the contact tracing log. So that's an important point. Regardless of vaccination status, masks will be worn by all participants at all times throughout the meeting. However, individuals may remove their masks temporarily while eating and drinking outdoors. And I just want to remind everyone, this is a scenario where you can have vaccinated and non-vaccinated people intermingling in an outdoor meeting. You notice that there is no social distancing requirement in this, right? So you could be pretty close to each other, vaccinated, non-vaccinated people. Even though you're outdoors, we want you to keep wearing your masks, but you can temporarily remove them for eating and drinking. And again, just the reminder that there may be some in-person service delivery operational policies and guidance from DCS and SAF that may be a little different to this. And if that's the case, anything to do with in-person service delivery from DCS and SAFIS is governed by their operations orders and policies. Building access. So we have control sites and other sites. The headquarters building downtown, our building at Long Beach, and our building at Pomona are all what we call controlled sites, which basically means they have front desk or security staff. So that means that during business hours, the buildings are open. You don't need to know a special key code or anything else to get in, and you can go and use those buildings. Exercise your fully vaccinated staff optional ability to use those buildings. At all other sites, you can still use those buildings, but you need to know how to access them. So so fully vaccinated employees who want to use a building that is not downtown Long Beach or Pomona, if you want to know how to access that building, in other words, things like the lockbox code to get the key to open the building and close the building, what the opening and closing procedures are. You may, depending on the building, you may need to enter a code into the alarm system so the alarm doesn't go off. Please email the facilities email box that you can see there with a request for access information. If you're an employee, this is the one part of the presentation where we are making a distinction between employees and volunteers. So employees email facilities, and volunteers contact either your DPM or DPS, or for your chapter or territory, or your volunteer supervisor. And that should cover all kinds of volunteers. So if you're DCS volunteers, you know who your DPM and DPS are. If you're any other kind of volunteer, you have a volunteer supervisor. Contact those folks, and then they can work with you to get the access information for the building you want to work from. And again, another reminder about signing in and out on that contact tracing log. And you also have to remain masked and socially distanced in the building. Okay, compliance. Trust your fellow Red Crossers. So I'm going to kind of do this a little bit in reverse because I think these points in the bullets make it clear why this is the core form of compliance. So Red Cross National Leadership has directed that we cannot request or require an individual to present proof or evidence of vaccination. They've also clarified that it's not a HIPAA violation to ask whether somebody's been vaccinated, and individuals are free to ask, and individuals are free to answer or decline to answer. But as Red Crossers, we're expected to be honorable and trustworthy. And if a staff member is working inside a Red Cross facility or physically present at a Red Cross meeting, we need to trust that our fellow Red Crosser is either fully vaccinated or is non-vaccinated but has been granted one of the limited exceptions. And I would just add that being open about your own vaccine status with folks around you, you don't have to be open about it, but I would encourage you to be open about it because it contributes to a culture of openness and trust, which is key to us all feeling good that the people around us are following the rules. Again, we've talked a little bit already about vaccine status reporting. All employees are required to report their vaccine status in HR Now. and all volunteers are strongly encouraged to report vaccine status and volunteer connection. Data about your vaccination status in either HR Now or volunteer connection is treated as confidential, but our department heads and managers have access to this information about employees, just like they have access to other confidential HR information about employees. And the RVSO and workforce engagement manager similarly have access to this information about volunteers if there's ever a need to verify an individual's vaccination status. If there are compliance concerns, first, we expect the vast majority of compliance issues are going to be minor and unintentional and easily addressed with a friendly reminder. But alleged violations of the policies can be treated like any other workplace conduct violation. So that means if you're comfortable doing so, start by addressing the issue with the individual directly. So for example, hey, just a reminder, our current rules require us all to wear masks indoors, so please put your mask back on. I bet that 99% of the time, if somebody's walking around with their mask pulled down and you remind them, they'll pull it back up and it won't be a big deal. But if you're not comfortable doing that, or if it becomes necessary, you can report the alleged violation to a manager, supervisor, department head, to me as the COO, and those folks can address the issue with the individual. We also have the ability to submit anonymous reports via the link you see on the screen. And again, that's going to be pushed out by email in multiple contexts. And we'll talk a little bit more about this link in a second. So these are really the keys to compliance. We also want your ongoing feedback. We're going to continue to refine these policies and procedures over time. We also understand that people want a way to anonymously report what they perceive as violations or questions or concerns. And so this link on the screen is your go-to for that. If you've used the version of this link we had set up when we moved into downtown, you'll know that you can report anonymously and you can put in your email address. We will never see that email address, but if you put in your email address, that allows us to email you back and follow up on the concern. Because obviously it's anonymous, so we don't know who sent it. And so if you're asking for a reply back, this tool allows us to do that. All right, now we're going to move to the Q&A session. So just a reminder, raise your hands in Teams and we'll call on you, or type your question in the chat. So I'm going to go and look in the, look in my Teams interface so that I can look and see which hands are raised and call on them. Okay, so I'm going to start with Carmela. Carmela, please take yourself off mute and ask your question.
Hi. So I saw Marcus's response in the chat, but in terms of openness, I don't have visibility, personal visibility on volunteer connection in my profile that I have submitted my vaccination status. You guys know that I am, or is there a trigger when you finish completing the filling out the form that says, thank you, we've received your, or, there's no indication that the process went through.
I see. Let me make sure I understand the question. You submitted it.
Yeah.
And the system doesn't give you feedback to confirm that it's submitted?
Correct.
So Carmela, that's a great question. I'm going to need to follow up with B and Marcus to understand how you as the volunteer can confirm that the submission went in correctly. I know that they can look that up on the back end, but I understand what you're saying, because as an employee, when I submit mine into HR Now, it tells me that it tells me that I was successful in that submission.
Right.
So
right.
I'll follow up on that, and we'll push out that information so that volunteers have that clarity.
Cool.
Yeah, thanks for the great question.
Thanks, David.
All right, let's see. I see another hand raised. Tom Bryant. Tom, please take yourself off mute and ask your question.
Thank you, David. I actually have two questions.
Great.
One has to do with your audio cutout when you were talking about training classes in a Red Cross building. Could you cover the requirements? What is an approved training class, etc.? And then the second question I'll ask after you answer the first, please.
Sure. Yeah, so that piece of the presentation, essentially what I was saying was that, so we have Training services, another important Red Cross line of service, line of business, utilizes our buildings for training courses. So you have, for example, they'll host CPR first aid trainings, basic life support trainings, those kinds of things, official training services trainings in our buildings. So students participating in those trainings could be considered to be, they could be perceived to be members of the public. In other words, they're not Red Cross staff members, they're not Red Cross volunteers or Red Cross employees, but so of course they're still able to go into our buildings to participate in those trainings. The other example would be participants in training services, nurse assistant training programs, and those kinds of things. So it really refers to those official trainings being run by our partners in training services. So that's the answer to your first question.
Excellent. Thank you very much.
Okay.
Second question has to do with development or any guidelines for rules of engagement in meeting partners in their buildings. Do we have any such guidelines developed or in development now?
That's a really great question. And my understanding of the national rules right now are that we're still not doing those kinds of face-to-face meetings. And it, again, it's sort of, if an individual employee wants to engage on a purely voluntary basis, if an individual employee who's fully vaccinated wants to engage in in-person interaction, they have the option to do so, but we're not at a point now where we can require them to do so. But I will check with our development team to see if they have any further or additional guidance specifically from a development standpoint, and we'll push that out.
Okay, thank you. My point of reference specifically has to do with shelter surveys where we are in a host facility engaging with the host as a partner. Thank you.
Yeah, and so again, anything to do with in-person DCS service delivery, which would relate to shelter readiness and that kind of thing, that's all governed by the new DCS rules of engagement. So I would, if you're in DCS and have questions about in-person service delivery aspects from DCS, I would check with our RDO Thomas or the DCS chain of command. Yeah, thanks for the questions, Tom. Any other questions? Please raise your hand if you have other questions, or I will look. Let me just, Tom, I'm just going to lower your hand so I don't get confused by the hands raised in the interface. I'm going to look in the chat now and see if there are chat questions. Dee, I just saw you raise your hand. I'm going to go back to you in a second. Let me just look in the chat for questions. I see the conversation between Marcus and a couple of others about their volunteer status, or sorry, about their vaccination status and volunteer connection. Alyssa asks, is there an estimated number limit for outdoor meetings? The answer is no right now, and it's really because we're trusting the department heads to make, we're trusting the judgment of the department heads who have to approve outdoor meetings. An outdoor meeting is very different from a large event. We're still not allowed to host large events. So, for example, a sound the alarm signature event is not the same as an outdoor meeting. And so if you submit a request to Thomas, who I'm addressing Alyssa, Thomas is Alyssa's department head. If Alyssa submits a request to Thomas to host an outdoor meeting, and Alyssa says, well, this outdoor meeting is going to have 500 people and we're going to be going door to door installing smoke alarms, well, Thomas as the department head can look at that, have that conversation with Alyssa, and know the difference between sort of a large event and an outdoor meeting. The guidance from CDC and others is sort of ambiguous in terms of what a specific numerical limit for an outdoor meeting or gathering might be. And that's why we made the intentional choice to respect the judgment of our department heads on that point. But great question, Alyssa. And I'm just looking again through the chat. Dr. Chung, who's our fantastic board member from Long Beach and was part of our post-pandemic work group. He cautions with regards to the Delta variant of COVID-19, it's more transmissible and will render the unvaccinated or partially vaccinated more vulnerable. And so I think Dr. Chung's point is a very good one, that we're approaching this with caution because COVID is still very real. There are variants out there, and we still need to be careful. And I'll share with you, we have even very recently, we've had staff members hospitalized and impacted by COVID. And so we do need to continue to take this seriously, even though many of us who are fully vaccinated, you know, I can share with you, I'm fully vaccinated and my social circle is fully vaccinated. It's really easy to feel like we're past this, but we're not. Let's see, I'm just looking at more in the chat. I hope someone is writing down these questions and answers, and we'll include them. So Jeff, good point. You'll note that I'm repeating the questions and answers, and this whole section is part of what's being recorded and will be distributed. Will this presentation be available? Yes, as we said up front, everything being presented here is going to be sent out to everyone and widely distributed. So you're going to have easy access to it. It looks like that's all I see in terms of specific questions in the chat. I am going to go back to the raised hands. And just forgive me, it takes a second. Okay, so D. Falasco. D, what's your question?
I actually asked it in the chat and didn't get a response.
Oh, I'm sorry.
I'm pretty sure I did submit it. Can I confirm it? Or if uncertain, should I re-enter it?
So D, that's a great question. I'm not sure if it was answered in the chat, but that's where I'm going to follow up. It's very similar to the question that that Carmela asked. I'm going to follow up and find out how volunteers can confirm that their submission was successful, so that you don't have to keep reconfirming it. I am looking in the chat, though. It looked like perhaps Jordan answered it.
Well, I'm pretty sure I submitted it the very day that you said it, but so
Yeah.
I don't remember seeing a banner or not seeing a banner. That's what
I see. And so Jordan's saying you should see this window when you submit it. I see. But that window pops up in real time. But I think per Carmela's question and what you're asking is, when you log back into Volunteer Connection, is there a way to confirm that it's in there? That's what I'm going to check on, and we'll get you that information. And Jordan says in the chat, you can always submit again. So it sounds like there's no problem if you submit multiple times, but I understand what you're asking for, D, and we're going to find that out and get that to you. So thanks for that great question. All right, back to the hands raised. Marcus, what's your question, Marcus?
Hey, David. Yeah, I just want to clarify from a DCS perspective and understanding to make sure that the terms are really clear, the difference between DCS managing service delivery part versus all other functions that may happen in a building. I just want to clarify that when you're referring to in-service person delivery, that's service to the clients in the prepare, respond, and recovery, not general meetings, not general trainings, not planning and organizing meetings. It's specifically service delivery to the clients. Is that correct?
That's correct.
Perfect. Thank you.
Yeah, thanks, Marcus. Thanks for that clarification. Gene Roski. Gene, what's your question?
Are we to continue social distancing in vehicles, the passenger in the right back seat?
Social distancing in vehicles is no longer required. Just please make sure that if there's more than one person in the vehicle, everyone needs to be masked. Great question, Gene.
And there had been a question in the chat, if there are two people who cohabit and are both fully vaccinated, can they do long drives unmasked?
So I'm going to tell you no, only because we are not going to be in the business of validating people's living circumstances. So our Red Cross policy is multiple people in the vehicle, everyone is masked. All right, let me look at the chat. Let's see, we have a question from Anusha. Anyone who chooses to come to the office complying with guidelines, would there be provision for COVID testing if needed, or does Red Cross have any guideline on testing? We do not, so the Red Cross does not, we're not providing generalized COVID testing. There are, in the past, there have been Cal OSHA driven scenarios where if there are more than 3 exposures in a building in a certain period of time, then everyone who has been working in that building is sent to get tested. But that's a little different than the status we're in now. So on a general day-to-day basis, we're not requiring you to be tested to go in and out of the buildings, and we're not providing testing. But that's, again, why these mask and social distance requirements remain important. Let's see, looks like Alyssa raised her hand, says Alyssa and one other. So I'll go to Alyssa and then I'll find out who the one other is.
Yeah, so my question is for folks who are unvaccinated and want to, especially downtown office or even Santa Monica, or just needing to drop something off or pick something up. Do they still need to pre-register?
Yes.
It's okay.
Yeah, unless you are, you will know who you are if you are a person who has been granted a specific exception as part of your job. So for example, if I have a business operations specialist who for whatever reason is non-vaccinated, I, as the COO, you saw in the rules, I have the ability to grant that person permission. So there may be a business operations specialist who I say, you're non-vaccinated, but you have standing permission to just pop in and out to check mail, do things like that. But if you do not know that you already have that authorization, then you need to get prior permission to just, even if it's just popping in. And again, the reminder is if you're popping into a building to get supplies for a DAT response, for example, then the rules governing in-person service delivery for DCS would apply. So, and you all in DCS know what those rules are. But as a general matter, if you're non-vaccinated, you have to get permission to set foot in our building for any purpose at any time, even if it's just a pop-in.
Copy that. Thank you.
All right. Thanks. Let's see. I don't see any other hands raised. I'm going to look back in the chat. And then I want to make sure that we don't forget about the folks who have called in. So let's see. I know there's some great conversation in the chat on the issue of validating whether a volunteer has successfully been able to put in their vaccine status and volunteer connection. So it looks like some people are getting those questions answered. Let's see. Okay, so I don't see any more substantive questions in the chat. There's some dialogue in the chat, but I don't see any new questions. So now I'm going to go to, I just want to open it up. If you have dialed in by telephone, we have, it looks like about half a dozen folks at the top of the list who've dialed in by telephone. If you've dialed in by telephone and have a question, please feel free to take yourself off mute, identify yourself, and ask the question. And if everyone does it at once, we may have to navigate that a little bit, but we'll work it out. So I'm just going to pause for a moment and see if anyone dialing in has questions. Okay, I'm not seeing anyone who's dialed in. I'm not seeing anyone come off of chat for questions. I'm just going to give another short amount of time to see if anyone has questions they want to raise their hand or put in the chat. So bear with me while I just give everyone that time. Okay, I'm not seeing more questions, and I'm not seeing hands raised for questions, and I'm not seeing questions in the chat. So I'm going to close out our Q&A session and just reiterate a couple of final reminders. So again, these rules and policies, et cetera, go into effect starting tomorrow, June 15th. A reminder that this is merely a first step. We're going to continue to update these policies as circumstances change. And a reminder that this presentation, along with a recording of this presentation in town hall is going to be distributed, as well as the key links. So our goal is to make sure that you have all the information you need to be successfully able to take advantage of these new policies, and for all of us to be as safe as possible as we move into this new environment. And with that, I'm just going to do one last look for any other questions. I don't see any. So with that, we're going to close out, and I want to thank you for your time today. And one final big thank you to everyone who participated in creating these policies and rules. We appreciate your energy and your engagement and your thought leadership on this. And we're going to keep moving forward together and performing our important humanitarian mission. And we all look forward to sometime in the future looking back and recognizing that the pandemic is fully in the rearview mirror. We'll get there eventually. We appreciate you bearing with us as we very slowly transition to a new operating environment. So thanks, everyone, and have a great afternoon.
Thank you.